Hey guys, it's Gabby. I'm going to be starting my signature assignment now. So I did my signature assignment on acromegaly, which is gigantism. This is a disorder caused by an overproduction of growth hormone in the anterior pituitary gland. In most cases, I saw that it's caused by a benign tumor called an adenoma that sits in front of the pituitary gland. Acromegaly can cause a person to have abnormally enlarged bones in the hands, arms, feet, legs, and head. And also, it thickens soft tissues that is found within the heart, lips, and tongue. So in this picture, it's kind of blurry, but you can see like the different types of glands and the organs that are affected by acromegaly, which include the hypothalamus, pituitary gland, thyroid gland, pancreas, testicles, pineal gland, thymus, adrenal gland, and the ovaries. And then over here, you can see the different bones and the organs that are affected by it as well, mainly within the head, the hand, the feet regions, like I said. So some physiology behind this. Within a normal person, growth hormone is produced in the anterior pituitary gland in the acetophilic somatotrophic cells. Growth hormone releasing hormone is produced in the hypothalamus and stimulates growth hormone and ghrelin, which is produced in the GI tract. Growth hormone affects growth in cartilage and bones in adolescent years, mainly in puberty, by sending signals to chondrocytes and osteoblasts, increasing replication. Insulin-like growth factors synthesized in the pituitary gland, liver, and other extrahepatic tissues also stimulate growth hormone by both directly and indirectly regulating rate of release of the somatotrophic and somatostatin cells. IGF-1 also activates something called the mitogen activated protein for growth in two different cellular pathways. So one pathway being ERKs, which regulate protein activation, and the second activates something called tyrosine kinase mediated pathway to increase metabolism, anabolism, and cellular replication in division. So, a person with acromegaly, there's a hypersecretion of the growth hormone and the IGF-1, mainly caused by somatotrope cell tumors in the pituitary gland. High levels of the growth hormone overwhelm growth hormone signaling, which include those mediated by SOX, SRC kinases, and tyrosine phosphatase pathways. This oversecretion of growth hormone is mainly concentrated within the bones and tissues area. So some demographics that I found, the prevalence of acromegaly ranges between 2.8 to 13.7 cases per 100,000 people. It is more prevalent in Iceland and especially in the Maltese Islands as well. The median age of diagnosis is found between 40.5 to 40.7-year-olds. And in a study that I found in the NIH, reported cases indicate comorbidities at diagnosis, and reported hypertension is about 48%. Diabetes mellitus is about 13%. Impaired glucose tolerance is about 19%. Heart failure is about 10%, and coronary artery disease is about 8% of most cases. So, fun fact, this is the tallest man in the world, named Robert Wadlow. The last recorded measurements was done by the Guinness Book of World Records in July 27th, 1940, and he measured at 8 foot and 11.1 inches. So, majority of patients are diagnosed at their more advanced stages because it's a slowly progressive disease. Because of this, when acromegaly is diagnosed, it's usually too late to reverse physical features affected by it. And once adenomas become macroadenomas, there's a higher risk of damaging the pituitary gland. Diagnosing acromegaly may require testing of GH levels with IGF-1 or oral glucose tolerance test. Also, an MRI may be used to check for the adenoma. Treatment may include surgery to remove the microadenoma if possible. medications to control growth hormone receptor antagonists, and somatostatin analogs. There is an AI model that I found used to detect acromegaly from facial photographs using something called support vector machines, convolutional neural network, and other machines to produce an ensemble method for facial detection. And then here are my references. And that's it. Thank you very much for listening, guys. I hope you have a really good day.